do you feel is the patient's role in treatment decisions?
So I know historically, a lot of times you come into an office, we tell you what you're going to get, and that would be it. Patients nowadays, I will say, are a lot more savvy as far as what drugs are out there. There are a lot more conversational groups on social media between patients who've had treatment before and newly diagnosed patients. So patients come in with a lot more information than they historically have before. So in that point, I think it's more of an open dialogue about what options we have, what options are best for you, and what our treatment goals are at that point. So by all means, given that we don't again have a standard of care, it leaves it open for discussion about sort of which route we choose to try to get your cancer under control.
Mm-hmm. Dr. Phillips, if a patient isn't feeling confident with their treatment plan or their care, do you think they should consider a second opinion or a consult with a specialist?
I think a second opinion is probably best for all patients. It's always probably good to get a different opinion about how the disease will be treated. So I do encourage all my patients, even here, to get a second opinion. Some take me up on it, others won't. But the option is always there to get a second opinion, just see if anybody would do things any differently. And I would say for the most part, most people will tend to treat the same way. Very seldom do we have differences in what our treatment recommendations will be. So I think the biggest difference in some situations, it's really about, some patients are very uncomfortable or being watched with an active cancer. And so in that situation, that's probably the biggest discrepancy we have nowadays because of the anxiety of, the watch and wait approach. Some patients would like treatment right away, irrespective of whether they need it or not. So you'll sometimes get some discrepancies about opinions about that.
Mm-hmm. What would you say to a patient who may be nervous about offending their current doctor by getting a second opinion?
You shouldn't be. If your doctor's offended because you're getting a second opinion, that's probably not the doctor for you. So I think at this point, any physician that's confident in the decisions they're giving you should not be offended if you go seek reassurance from somebody else.